participants will later join.
Last time we were speaking like this, that was recorded. It is there in.
Good evening, sir.
Good evening, all. This is Chandra Mohan, physiotherapist. I welcome all for the free online coaching for PGET, postgraduate entrance test for MPT exams. So we are nearing exams. I think by August there will be exams for SV Nirtar and other centers, colleges, and most probably many of our private colleges also having entrance tests. So I welcome you all for this learning session. And by next month, we are going to give mock tests also, that there will be 100 questions you have to work out within 2 hours. And after that, there will be a paid session also. Those who are interested, you can attend that one. So it will be like a package of covering many questions. And after that, those who paid will go for one more mock test before exams, and it will be helping you. This is a little try from our side to help you to score good marks. So without wasting time, I welcome our resource person, Dr. Arun Balasubramaniam, sir. Welcome, sir.
Thank you, sir.
Yes, sir. Please start the session. Yes, sir. Please, sir.
Is it visible, sir?
Yes, sir.
Yes, sir.
So, good evening, students, and good evening, my friends. So, I think this is the second month I am going to take the class because this is class number 8. So far, I think the classes will be very, very useful. And as like the pattern of how I am going to take the same pattern only. We have questions as well as we have photos, and the pictorial we are going to find out what is the picture. As discussed in the last class, what I was did are the pictures which are the GIF images, which are the gait patterns, because today's topic we are going to cover the gait. So I just took some pictures, the GIF images of the gait. So you please find out what is the GIF patterns or what is the images, right? What is the gait, abnormal gaits. So we are going into the first slide is name the gate. What is the name of this gate? Kindly answer me in the chat box. So all the gate patterns are very easy, right? It's all circumflex gate, very good. And we can easily circumflex gate are commonly seen in the hemiplegic patients. Sometimes some people will also walk in the circumflexion if the patient having pain, severe pain in the hip or severe pain in the knee. The patient was unable to bend the knee. They may go for this circumflexion gait, but mostly circumflexion gait is very common in stroke patients. So we are going into the question number 1. As you know that today's question is on progressive resistive exercises. They are on the progressive resistive exercises. All of the following statements are true, right? All of the following statements are true about the benefits of resistance exercises, except so all the statements here are true. Only one is untrue. Increased stress in the joints during physical activity, possible improvement in the balance, possible improvement of perception of disability, reduced risk of soft tissue injuries. All the statements are true except one, which is that one. Then they answer me in the chat box. Is it increased stress of the joint in physical activity, possible improve of balance, or possible improve of perception and disability, or reduce risk of soft tissue injuries? Okay, so far no one has given a correct answer because B is not the answer or either C is not the answer. The correct answer for this question is increased stress to the joints in physical activity. Because when you do exercises, the joint stress was reduced by strengthening of the muscles surrounding the joint. Stress to the joint is reduced. When you do exercises, it improves balances, right? So any exercises improves balance, especially when you do resistance exercises. It improves proprioception, kinesthetic sensation, it improves balance, improves perception of disability, and reduce soft tissue injuries, as well as it reduces the stress to the joints, right? When you do physical activity after doing resisted exercises, the stress to the joints are rapidly reduced. So increased stress is the wrong answer. We move on to the next question. Which principle determines the exercise prescription like parameters for specific exercises? Which are the principles helps to determine? Is it reversibility principle, retraining principle, SAID set principle, or overload principle? Which principle helps to determine exercise prescription like parameters for specific exercises? Is it reversibility, retraining, overload principle, or set principle? Okay. Overload principle also does, but this overload is not the correct answer for this question. Okay. Any other good answers? I can see someone has tried to B, right? B. So the correct answer is B. It is set principle. So what is said is specific adaptation to imposed demands. So set principle works on the Wolff's law. So what is Wolff's law? Stress induces bone growth. So Wolff's law, what we are going to be followed when we are doing a non-weight positive weight bearing or full weight bearing after a fracture. When you just ask the patient to start weight bearing, it enhances the bone growth. So we are following the Wolff's law in our management, right? And in the physiotherapy, actually musculoskeletal rehabilitation. So set principle is based on that. Right. So question number 3, which fibers are low force production and resistance to fatigue? It is not easily fatigable. Which are the fibers which is not easily fatigable? Is it type 1 fibers, type 2A fiber, type 2B fiber, or type 3 fiber? Which fiber has got low force production, resistance to fatigue, which is not easily fatigable fiber? So type 1A, type 2, type 1, type 2A, type 2B, or type 3 fiber? Which fiber has reduced fatigue? Because it works on aerobic, right? Aerobic exercises are enhanced by these fibers, prevents these early fatigues. Which is the fiber? Okay, someone answered A, that is very good. Very good, very good. So the A is the correct answers, because when we see this the graph, we are able to identify type 1 fibers as well as type 2A fibers are work on the aerobic capacity, whereas type 2B fibers is anaerobic. So fatigability rate of type 2B is very fast, whereas type 1A fibers is fatigability rate is very high because it is not getting easily fatigued. Plus type 2A is intermediate. It may go exercises for some period, it may resist the fatigue, but it also goes for fatigability. So type 1A fibers work on aerobic exercises, and we have worked on aerobic energy systems. The diameters are small, twitch rates is low, muscle maximal strength is also slow as well. It has lot of resistance to fatigue. Right, so the next question, one statement is false about the muscle fatigue. Which is that statement? Active movements are jerky, not smooth. Ability to continue low physical activity only. Use substitute movement. Unintentional slowing of movement with a successive repetition of exercises. Which statement is false in the muscle fatigue? Muscle fatigue occurs, all these things happen except one. Is it active movements are jerky, not smooth? Ability to continue low physical activity, use substitute movement, unintentional slowing of movement with successive repetition of exercises. Can the answer fast? Okay, ability to movement, right? D is not the right answer. D is the correct answer. A is also correct. Because once you are fatigued, you are not able to move smooth and rhythmic movement. Your movements are always jerky, and you will get unintentional slowing of movement with successive repetition of exercises. One person says C. C is also not correct. The correct answer is the ability to continue low intensity physical activity. Actually, the patient or person was not able to continue even low intensity physical activity, because once the muscle is fatigued, the muscle was not able to do any movements. Active movements are jerky, it is not smooth. So patient was not able to do a smooth movement and use a substitute movement. When you ask the patient to lift the shoulder, he will also lift with the trunk. Unintentional slowing of movement, right? When you ask the patient to do movement for 10 times, after third time the movement was slow because of the muscles become fatigued. And the patient ability to continue low intensity physical activity is not there because the patient was not able to continue even a low intensity exercise also. The patient was lifting 1 kg and the third movement when the patient was shivering, when you give half kg, even he was not able to do because the muscle becomes fatigued, right? So the correct wrong answer or the right answer for this question is the false statement is ability to continue low intensity physical activity. Okay, very, very easy question. What is this gait? By seeing this photo, you are able to answer right. High stepping gait, very good. So common peroneal nerve injury causes high stepping gait. It may occur even as sciatic nerve palsy, upper sciatic nerve palsy may also lead to high stepping gait, or any fractures around the neck of fibula. Also, very rarely, leprosy may also get involvement of common peroneal nerve results in the high stepping gait. Patient was unable to do active dorsiflexion to avoid the dragging the leg, post or plantar flexion to avoid the dragging. The patient voluntarily lifts the leg and keeps it. There is no smooth movement in the foot, right? They just slap it, right? Okay, next question is exercises which involves low intensity isometric contraction performed against little or no resistance is called as exercises which involves low intensity isometric contraction performed against little or no resistance is called as multi-angle isometrics, muscle setting exercises, stabilization exercises, or rhythmic stabilization. Which exercises involves low intensity isometric contraction performed against little or no resistance? Stabilization exercises, good, right? Muscle setting exercises, very good. As it indicates, it is a low intensity isometric. So the correct answer is muscle setting exercises is the right answer. So muscle setting exercises are used to decrease muscle pain and spasm. It also promotes relaxation and circulation to the soft tissues. So usually muscle setting exercises we do for the quadriceps as well as gluteal muscles. Why quadriceps? Quadriceps is the first muscle which gets easily fatigued, and muscle wasting is very, very common in quadriceps only. And the patient was bedridden for just 5 days. The first muscle which gets paralysis or weakened is the quadriceps muscle. So we have to start early muscle setting exercises. That's why we have started giving isometric quadriceps exercises in the early phase of rehabilitation. Right? So muscle setting exercise is the correct answer for the question number 5. Okay, question number 6. Isometric contraction should be held for not more than how many seconds? Very, very important question. It is 10 seconds, 15 seconds, 18 seconds, or 20 seconds. How many seconds you are able to hold or you are able to continue isometric contractions? Is it 10 seconds, 15 seconds, 18 seconds, or 20 seconds? Why we are not able to hold it more than that? Because of there will be vasoconstriction occurs in the blood vessels, which causes, if the patient is a cardiac patient, then there will be cardiac compromises to be there. So you are not able to hold isometric contraction, increase isometric contraction for more than this seconds. Option B is not the right answer. It's not 15 seconds. Right, so then we'll see the correct answer is 10 seconds. Why it is 10 seconds? So as per the protocols, it is 2 second rise, 6 seconds for hold, and 2 seconds for fall. That is a protocol for isometric contractions, right? So 10 seconds means 2 seconds rise, 2 seconds falls, and 6 seconds holds. Please remember it. When you are going to teach any patients on isometric exercises, when you are going to teach patients or either as a geriatric patients, elderly, younger patients, the contraction holding time is only 6 seconds, 2 seconds for rise and 2 seconds for fall. So the whole contraction should not be more than 10 seconds. Right. What type of breathing is encouraged during isometric contractions? Is it rapid breathing, rhythmic breathing, sniffing, or relaxed breathing? what type of breathing is encouraged during isometric contraction. When you ask the patient to do isometric contraction, what type of breathing should be there? It be relaxed breathing, relaxed breathing, more or less correct. Prana is the right answer. Right? Komal also got right, and it is rhythmic breathing. Rhythmic breathing is the correct answer because the patient has to do rhythmic breathing to avoid pulsar maneuvers. Right? Very good. Okay. Question number 8. All the following characteristics are true about concentric exercises. It's a very easy answer, but it looks for long answers. But when you read the answer, you are able to find answers easily, right? All of the following characteristics about concentric exercises except. So everything is related to concentric exercises. Concentric exercises are a form of isotonic exercise, right? Maximal concentric contraction produces less force than maximal eccentric contractions, right? So contraction of maximal concentric, it produces less force than maximal eccentric contraction. In concentric contraction, greater number of motor units are recruited. In eccentric exercises, consume less oxygen and energy stores than concentric exercises. DOMS, delayed onset muscle soreness, is common in concentric exercises. Which of the statement is false?
In YouTube also D and B.
Yes, B is not the right answer, whereas D is the right answer, right? Excellent. Those who are answered D is very good. DOMS, delayed onset muscle soreness, is very common in eccentric exercises than the concentric exercises. Other features are the characteristics of concentric exercises. Delayed when you do eccentric exercises, if you are not doing a proper warm up, if you are not training the muscles properly, then the patient will have lactic acid accumulation, results in delayed onset muscle soreness. So, DOMS is very common complication or one of the important features in the eccentric exercises. Although eccentric exercises are comparatively very good in strengthening than concentric exercises, one of the disadvantages of eccentric exercises are DOMS. So when we train some people with eccentric exercises, we have to have a good protocols like warm up and cool down phases to avoid the lactic acid accumulation. Okay, very easy question. What is this type of gait? So usually commonly found in the cerebral palsy children. What is this type of gait?
Those who are watching in YouTube also can answer.
Scissoring gait, very good. Scissoring gait, very common in the cerebral
Sir,
palsy.
can you please play it again, sir?
If I open the chat box,
Yes.
I think it is stopped.
Okay, sir.
Okay, we are moving into the question number 9. While training a concentric isokinetic exercise, the angular velocity for medium training is. So when you are training a concentric isokinetic exercises, the angular velocity is 30 to 60 degrees, 60 to 180 degrees, 180 to 240 degrees, or 220 to 260 degrees. Isokinetic exercises. What is the right answer? So the A, B, C, D. 30 to 60 seconds, 60 to 80 seconds,
60 to 180.
180 seconds, 180 to 240 seconds, 240 to 260 seconds. It's a medium velocity, right? And the medium velocity training, we have to have 60 to 180 seconds, right? So, as per the classifications, so isometric is 0 seconds, slow is 30 to 60 seconds, medium is 60 to 180 seconds, and fast is 180 to 360 or above. When you are going to train some patient in isokinetic exercises using equipment, we have to follow these protocols to improve their muscles. Related to isokinetic, we'll see in the next few questions. Okay, velocity specific training is done using isokinetic devices, variable resistance, plyometric, or DECR. Velocity specific training. Velocity specific training. When you say velocity specific training, the answer will be velocity specific equipment. What velocity specific equipment is? Answer A, right? isokinetic devices is the device which helps to do training in the velocity specific training. So the term isokinetic refers to the movement that occurs at an equal velocity. That's why it is called as isokinetic, and it is also called as accommodating resistance exercises. So main advantage of isokinetic exercises are when you train some muscle in some particular range, we are able to train it. For example, you want to train shoulder abductors in 10 to 15 degrees, you are able to train within the same degrees with the constant velocity. But using the isometric training or using the isotonic training, we are not able to do that, right? Whereas isokinetic is very, you are able to do that. And one of the advantage of isokinetic exercises, it is very good for the sports personality, so that we are able to train every individual movement of the sports persons. Whereas in the normal public, we do not need that much individualized training. Whereas for the sports person, we are able to do a individualized muscle training using that equipment. Right, question number 11. Muscle activation occurs in the multiple muscle groups with both distal and proximal to moving joint is seen in. Right, if the joint, both the muscles are all, multiple muscles are working in the joints. So which type of contraction you can see multiple muscles working? Is it open kinetic? Is it closed kinetic? Is it stabilization or isometric exercises? Which muscles you are working? You can see that. Contraction.
The options are A, closed chain exercise.
Closed chain stabilization exercises, open chain exercises, or isometric exercises. Very easy only, right? And because multiple muscles work only in the open chain exercise, so closed contraction exercise, because both the joints are fixed, so the multiple muscles will work. Although you can say stabilization exercise also work, but for this pertain to this question, closed kinetic chain exercises will provide movements of multiple muscle groups, like a push-ups. So you do push-ups and keeping your hand on the wall or on the chair, then the shoulder muscles as well as elbow muscles and wrist muscles, every muscle will work. The distal to proximal. Okay, question number 12. Following a vigorous exercises, which modality helps in reducing signs of muscle damage? Following a vigorous exercises, which modality is used? Although all the modalities we can give, but which modality is acute you can give? Is it cryotherapy, TENS, massage, or electrical stimulation? And vigorous exercises, which modality is best? Cryotherapy, TENS, massage, or electrical stimulation? Everyone has got the point. So acute, you have to give only cryotherapy. So cryotherapy is the right answer. This cryotherapy is given to reduce the muscle damage. So same as some of the literatures also supported, if there is a fatigue occurs in the muscle, you can give cryotherapy also. It also helps to prevent, but also helps to reduce the pain in the fatigue muscles. Apart from that, the TENS also works, electrical stimulation also works, and the electrical stimulation and TENS massage also works in preventing the muscle damage following a fatigue. All these modalities play a major role. Okay, very easy question. What is this gait? Please watch the gait properly and answer. What is this gait? Which muscles is affected? What is the name of the gait?
Answers are coming in chat box, sir.
Trendelenburg gait, it's not latching gait, it is Trendelenburg gait because of weakness of the gluteus medius muscle, right? So you can see the hip was not stable, the patient have a slight tilting of the hip. So it's called as Trendelenburg gait.
Many are answering in YouTube as waddling gait, antalgic gait, 2-point gait.
We have one more picture of waddling gait. I have released the answers.
Yes, sir.
Okay, question number 13. At a normal walking speed, double support occupies dash percentage of gait cycle. Normal walking speed, double support occupies dash percentage of gait cycle. Is it 2%, 10%, 11%, or 22%? 2%, 10%, 11%, or 22%? The whole gait cycle takes 22%. I accept the answers, but still start with double support occupies. So 22 is not the answer, correct answer. It's also not the right answer. So BD is not the right answer. It is not BD, it's not 2%. So we have to fall to the 11%. So the 11% is the right answer. 22% is for the full gate cycle, but the normal walking speed, the double support time is 11%. Okay, according to Ranco's laws, amigos, the percentage of mid swing is 60% to 75%, 73 to 87%, 75 to 85%, 85 to 100%. We have in the gate, we have two types of, one is traditional and other one is the Ranco's Los Amigos, RLA. So we always follows the tradition, we never follow the RLA. I just want to test your knowledge by asking. Or C is not the right answer. Many of them are putting C. C is not the right answer. Maybe this is the only right answer. Okay, so move on to the answers, right? So it is the B, 73% to 87%. So in the traditional, you can see early swing is 60 to 75%, mid swing is 75 to 85%, late swing is 85 to 100%. Whereas in RLA, initial swing is 60 to 73%, mid swing is 73 to 87%, terminal swing is 87 to 100%. I know it's a tough question, but still, I just want to test you. This is available exactly in our India knowledge. Okay, distance variable includes all except. So all these are distance variable. So one is not the distance variable, which is the plan. The step length, stride length, single limb time, or degree of toe, which is not the distance variable. So step length, stride length, single limb time, and degree of toe, which is not. Right? We have distance and very good. So everyone has given answer C. So I also go with answer C. Single limb time is there. Is not the distance variable. When you look at the temporal variable and distance variable, temporal variable measures the time, whereas distance variable measures the length. Like temporal variables like stance time, single limb time, double support time, swing time, stride time, step time, cadence, and speed. All are temporal variables which measures only the time. Whereas the distance, the amount of distance was measured, or the angles was measured using the distance variable. Step length, stride length, step width, degree of toe. All these are the distance variable. Right? Okay, very easy question. Number of steps taken by a person per unit of time is step duration, stride length, cadence, and walk speed. Number of steps taken by a person per unit of time is step duration, stride length, cadence, or walking speed. Very easy, right? Because in my secondary also I was able to memorize this cadence. So what is cadence? Number of steps per minute is called as cadence, right? Number of steps per time. Usually male have 110 steps and female have 116 steps. Right, what is this gate? It is antalgic gate, ataxic gate only, but just tell me what is this gate. Very good. Parkinson's gate also right, fascinating gate also right. Short stepping gate, excellent. Fascinating gate, also called a short stepping gate. Usually seen in Parkinson's disease. Correct answer. So everyone has given a correct answer. Okay, so same distance variable. Degree of toe angle is 7 degree, 12 degree, 10 degree, 3 degrees. That is the degree of toe angle. Very easy, right? 7 degree. Right. I also go with your answer. 7 degree is the right answer. The degree of toe angle, right? So when you walk and the toe angle between the first and 2 degrees is the degree of toe. And the angle measured is the 7 degrees. Okay, question number 18. Range of motion of ankle joint in the mid stance is in the mid stance, right? So normally walking and the mid stance is what is the range of motion of the ankle joint? Is 10 degree plantar flexion, 5 degree plantar flexion, 10-degree dorsiflexion or 5-degree dorsiflexion. During the mid stance, what is the ankle joint position during the mid stance? Is it 10-degree plantar flexion or 10-degree dorsiflexion? 5-degree plantar flexion or 5-degree dorsiflexion? Don't try to walk and then answer it. Just observe. 10-degree dorsiflexion is not the right answer. So you want to go with the D or A or B? I thought C is not the right answer. How come 10-degree plantar flexion is mid stance? Mid stance is the place where your ankle is in neutral or your ankle is in the ground with the foot. So plantar flexion is not at all possible. So what is our dorsiflexion only occurs? Is 5 degrees of dorsiflexion. You can see the picture, you are able to understand it better. So
Mostly be answered, sir, in YouTube.
No, the mid stance, the picture is the answer for the question, right? The 5 degrees of dorsiflexion is there. And knee also is 5 degrees. And hip is 0 degrees of flexion. That's why something will get controversy. I just took the picture from the textbook and placed it here. So that the book will give you answers for the questions. So in the mid stance, we are going to ground the foot, so there will be no chance of plantar flexion. Whereas the dorsiflexion only, but the dorsiflexion might minimal dorsiflexion occurs. Very minimal, like 5 degrees. Okay, in gait, during arm swinging forward, which medial rotators are active? In gait, when you do arm swinging, which medial rotators are active? It is major, posterior deltoid, supraspinatus or trapezius. Which medial rotators are active? It is major, posterior deltoid, supraspinatus or trapezius. Medial rotators. So posterior deltoid is not a medial rotator, so it is kicked out from the answers. So it is ACD only.
Posterior deltoid, C, supraspinatus, D, trapezius. In YouTube, mostly A are the answers.
Yes, everyone is correct. A is the answer for this question because it is major, play a major role in the arm swing. It's not posterior deltoid or trapezius. Okay, 20 question. Quantity of mass multiplied by the height to which it is raised. Quantity of the mass multiplied by the height to which it is raised is called as translation energy, rotation energy, potential energy, or kinetic energy. Quantity of the mass multiplied by the height. It's translational, potential, rotational, kinetic. It's translational, rotational, potential, or kinetic. Mass multiplied into height. C. Okay, C is the right answer. Anyone has answered C, potential energy. I just want to check your knowledge by giving this as a question. Very easy question. What is the name of the gait? Usually seen in polio patients, right? So nowadays polios have started decreasing, and successfully India does not have polio for the last 5 years. Right? So because of the mass vaccination by the government and the vaccination plays a major role. Like Sabin and Salve vaccine play a major role in preventing the children getting from the polio. Right? So polio virus is eradicated in India. As many developed countries has eradicated polio, so India is also joined in the list. It's hand to knee gait, right? Also called as quadriceps gait. It's also called as quadriceps gait, also called as hand to knee gait. Why the person wants to keep the hand on the knee is to make the knee in extended position. Otherwise, he was not able to walk. So, by using the hand, he is pushing the lower end of femur downwards to make the knee active or passive extension, and then he walks. Right? So this GIF, he's just walking only like 1 or 2 steps. Probably if you watch a patient with a polio condition, you can understand this better. Okay, running gait dash muscle shows 25% of activity in gait cycle, from late stance to the early part of swing phase. From late stance to the early part of swing phase, which muscle is 25% activity in running gait, not in the normal gait. So iliopsoas, adductor magnus, quadriceps or medial hamstrings. In the 25% of gait cycle from late stance to the early part of swing phase. Iliopsoas, adductor magnus, quadriceps or medial hamstrings. Iliopsoas, adductor magnus, quadriceps or medial hamstrings. Which muscle? Which is the muscle responsible
Many
for
are answering as
25%
A in YouTube, sir.
A is not the answer.
The mixed answers are coming now. D, C.
The medial hamstring also not the right answer.
So only the options are P and C.
B and C.
Either call a friend or call your professor.
Now I can give some clues, but it is difficult when you are there writing exams. Right?
Yes, yes, sir. But still
So
they
the
will
answer is
remember.
adductor magnus. Adductor magnus is the muscle which play activity of from late stance to the early part of swing phase, especially the gait, running gait. Okay, linear distance between two successive points of contact with the opposite extremities. Opposite extremities, two successive points, right? Linear distance between two successive points of contact of the opposite extremities. Step length, side length, single support time, step duration. Opposite extremities. That is a clue here. Step length, side length, single support time or step duration. It's not single support time or step duration. There is an option between A and B. Someone says PF. What is the PF? There is no option of F. So the correct answer is the step length. What is step length? When you are going to measure your foot from the one foot to the opposite foot, it is called a step length. Whereas when you are measuring from the same foot from one step to the other step of the same foot, is called as the stride length. Right? So step length is from the one step to other step, right step to the left step. How much step is the length is the step length. Whereas when you are calculating right step, left step, then to the right step. So we are calculating the right step, and the right step is called as the stride length. Most of you has given a correct answer. Okay, all the following statements are true about toddler gait pattern. Toddler gait pattern. So it is for kids. Except, so every statement is true about toddlers except one. Walk with wide base of support. So toddlers walk with wide base of support. Toddlers have high center of mass than adults. Toddlers have low cadence compared with adults. Short step length seen in toddlers. So all the statements are right except one. One is the false statement. Which is that statement? Is that toddlers walk with wide base. Toddlers have high center of mass. Toddlers have low cadence. Toddlers have short step. Which is the wrong answer? I think everyone has given right answer so far. It's not B. Yoshita, please think. Others have given right answers. Not A. A is not the right answer.
A and C are most answered here.
Those who are C, pat your shoulder. C is the right answer because the cadence is not low. Cadence will be higher because the child always walks or runs than the adult. So the cadence, the number of steps per minute is higher in the children, more than 110 steps than the adults, right? Because the child will walk, will run like anything. Because that walks with wider base of support, has high center. Because of wider base, the center of mass is more, and stop step length. I think the length is long. The cadence, low cadence is. So if they don't have low cadence, they have high cadence. Cadence is more. Okay, we are moving into the last part of the program, and Swiss ball diameter for short-legged person. I think I have taken with this question from a textbook on Swiss ball. So it was really interesting. So just I want to make you to learn. So I just take this question for a short-legged person, 55 centimeter, 60 centimeter, 65 or 85 centimeters. What is the Swiss ball size for a short-legged person? 55, 60, 65, 80. B answer B. B is not the right answer.
Short leg person, 60 centimeter is the wrong answer.
Yes, 60 centimeter is a long answer. As
Now
per the
you have
textbook
3
written by
options.
as per the textbook written by the author, I forgot the author name. I'll check and put it in the WhatsApp group. So they jump into A, right? So A is the right answer, right? So 55 centimeter for a short leg person. This picture also I took it from the textbook only. Thank to the author also. What is the difference of the short leg is when you see the person, both the person, the leg of the person who was standing on the left hand side is the person with the short leg. So this person needs a 55 centimeter ball only. But when they sit, the height are more or less equal. But the flexion of the knee is more on the person who wears a dark t-shirt than compared to the person with a light t-shirt. So the person on the right hand side requires a larger centimeter ball, whereas the person on the left hand side requires a smaller centimeter ball. So always when you select a ball for a Swiss ball, make the patient the knee is 90 degrees of flexion. So that is a range we are going to select for selecting a Swiss ball. Right. So what is the name of the gate? Very simple question. Already the task mark in Tamil Nadu was open, so everyone can answer this question.
They already told it for Parkinson's.
This is not Parkinson's gate. Okay, Parkinson's
No, sir.
also
That answer. This
okay,
answer.
okay. They are told right. So you can if you put
Yes.
the colloquial also okay. Drunken gate, okay. Drunken gate also accept.
Taxi gate, staggering
Taxi
gate.
gate, staggering gate. Okay. Taxi gate is the right answer. Drunken's gate is also the right answer because of ataxia, the patient was not able to get a proper balance. So they walk with wide base, instability will be there, and the patient was not able to do that. Okay, very good. And we are moving into the 25th question. Length of the TheraBand is 2 feet, 4 feet, 5 feet, 7 feet. What is the length of the TheraBand? Who will measure all these TheraBand? We use it for the exercises and we throw it away. Is there to measure the
Length of the TheraBand.
length of the TheraBand? 2 feet, 5 feet, 4 feet, or 7 feet. It's not obviously 2 feet. 2 feet is very small. It is not 2 feet.
They thought that it may be a TheraTube one, that is round one.
Yeah, TheraBand is different and TheraTube is different. Okay, everyone has answered very near, not the right answer. So right answer is 5 feet is the right answer. The TheraBand length is 5 feet. So those who answered 5, you can tap your shoulders, right? Because you have answered 5. Correct. C is the right answer. Okay, moderate resistance TheraBand is what color? Pink color, blue color, yellow color, green color. Which color is the moderate resistance TheraBand? Pink, blue, yellow, green. Pink, blue, yellow, green.
Neither it is easy nor it is too much resistance. It's moderate.
Moderate resistance. Pink, yellow, blue. Okay, someone answered green, someone answered yellow. Okay, so the answer is correct. Answer is green. Green is the right answer. I will show the picture also. The pink and yellow are the moderate mild resistance TheraBand. Green and red are the moderate resistance TheraBand. Black and gray are the high resistance TheraBand. Right? So every TheraBand has got resistance, and you have to select the TheraBand depends on the patient need. Do not just ask the patient, go and buy all this TheraBand. You can also buy it in the Flipkart. You can also buy it in Amazon. Please don't advise it. You please advise it, or you have to be there when you are going to teach the exercises. Right? So TheraBand initial training to the TheraBand needs some supervision. So therapist has to supervise how they are doing. And once the patient was able to overcome this resistance, they should not fold the TheraBand and then do. That is also wrong, because if the TheraBand is 2 kgs of resistance, when you fold it, it becomes 4 kgs. We have to gradually increase resistance by 2 kgs to 2.5, 3 kgs, and then to the 4 kgs. Not all of a sudden 2 to 4. When you go 2 to 4 all of a sudden, then it causes injury to the to the part or to the soft tissues, then patient will start blame us only, right? So you only told to do therapy, and after doing therapy, I'm getting pain again. Because the patient thinks that the resistance was very less, so he doubled the therapy and that started doing exercise. Yes, sir, please tell, sir.
So blue color is also there.
Yeah, blue color is also there. Is it mentioned? That the mention which I have told you. Right? Blue
Where
color
does
will come under the mind only.
okay, sir.
Okay, what is the name of the gate? Very, very easy. You have told the answers before itself. Can someone say that some colloquial name for this gate? You remember, Battling gate is the right answer, but what we'll call it as colloquially?
Yes.
Duck
The
walking gate,
answer
very good. Duck walking gate is the colloquial. Battling gate is the correct answer for this. So what is Battling gate? Waddling gait is a gait where bilateral gluteus medius weakness, bilateral hip abductors weakness causes waddling gait because the pelvis is not able to stabilize it. So the pelvic drop occurs in both the directions. So bilateral hip abductors weakness. Duck walking gait are also called as waddling gait. Excellent. Right, which has high evidence that influence poor adherence of the home exercises program. Which has high evidence that influence all are the evidences which shows that the patient adherence is poor in the home exercise program, but which has high evidences. Based on the literature, they found that this is the exercise, this is the reason why patient is not at all following home exercise program. There is low motivation, lack of social support, low level of optimism, or high disability, which is the commonest reason why patient is not adhering to the home exercise program. Low motivation, lack of social support, low level of optimism, or high disability. Because I have given you the topic of home exercises, at least I have to take 1 or 2 questions from the home exercises. I think I've given is the correct answer, right? So it is A. Very good. No other guesses? So no other answer. So I am just going with him. Low motivation is the right answer for this question because the patient motivation is low, so he is not or she is not adherent to the proper exercises. Although we have given a list of home exercise program, patient will never do. Or the patient will say, I did sir, but the improvement was 0. So why is because of low motivation? Although there was a lack of support, is that the husband has to encourage him, or the son has to encourage him, or the daughter has to encourage him, or the wife has to encourage him. That is also process. That is also one of the factors why the patient is not doing exercises. Self-optimism. Patient is not interested. I was not able to do. I was not able to. So low level manners or low level optimism also is one of the reasons why the patient is not doing home exercises. And disability is high. The patient was not able to lift the shoulder. He is complaining pain. So because of severe pain, the patient will not do the exercises. But all of these, the high evidence is low motivation. Patient doesn't have motivation to do exercises. Or the patient will do 2 days, they actively do. After 3rd day, his motivation will get lower. Okay, so one more question from the home exercise program. All the following factors encourages adherence to home exercise program except. So when all these factors make the patient to accept or to do the home exercise program except providing verbal advices, encouraging patient to keep logs, diaries, teach pain management strategies, reviewing exercises at regular intervals, which is the factor which is not adherence to the home exercise program. It's not increased adherence. But it's the factor which is least adherence to the home exercise program. Right, so everyone saying answer A is providing verbal advice. That's the correct answer again. Because why it is the right answer is because when you give any exercise program to the patient, especially the home program, you have to give some pamphlets or some exercise descriptions. so that patient will go and refer it when they are doing. Nowadays, the patient have a camera, they can take a picture of the exercises program, you can paste it in the clinics or the hospital, they can take a picture and they can use that as a reference. Just providing a verbal advice does not make the patient to attend it, because they will hear this here and they will leave everything this here and they go out. When they go out of our physiotherapy department, they forget totally what is physiotherapy. So you have to give some handout so that the patient will be able to remember the exercises. Okay, apart from that, if you don't have handouts, ask the patient to do 5 times, 10 times in front of you in the department, and then ask the patient to go home, because when they do repetitive times of exercises, or make the patient attenders to stand near the patient and ask them to watch it. Like husband means wife, wife means husband. If the person is standing near to the patient, watch the exercises, they are themselves remember, and they also advise the patient. So providing verbal advice is not a good factor which make the patient to adherence to the exercise program. Encouraging patient to keep diaries and logs are very important, because you can also ask the patient to do 10 times of some exercises. If the patient is done the 10 times, he can make the note on it. After 1 week or 10 days, when the patient comes back to the reviewing, you can see the logbook and find out how many days the patient was able to do the exercise, or how many days he did or she did. If the patient was not doing it, you can ask the patient, you can question the patient why you are not doing it. Like, so that because to fill the log only itself, the patient will start doing some exercises. Teach pain management strategies, that is very important, because if the patient complains pain, then the patient will not do the exercise. So how to overcome pain? If you are telling that do 5 times, then reduce to first start with the 2 times, then increase to 5 times, then increase to 10 times. So reduce the number of repetitions so that the patient will not feel the pain, or they are able to manage the pain there. Reviewing exercise at regular intervals is very important. Nowadays, the social media, the distance between the patients are very less. So even if you ask the patient to do exercises, take a WhatsApp video and send to you, or you can also do a video call and ask the patient to do the exercises, right? So all the factors are there, except this verbal advice. Providing verbal advice is not good. Okay, Pilates mat should be dash length. What is the length of the Pilates mat? Is it 6 feet, 10 feet, 5 feet, or 7 feet? What is the length of the Pilates mat?
Our Pilates instructor is also available in a Zoom. I expect his answer.
So we will see correct answer for this question. I have to get from the textbook, so not blame me. Sir, this is not the right answer. As I am practicing, this much is the right answer. Right? I just took it from a textbook. Every question I have to get from a textbook, I have references. Because I always speak references. 7 feet is not the right answer. In India, 7 feet is more like very. You can number the people with 7 feet, like Amitabh Bachchan only 7 feet. So the right answer is A. Archana Yadav has given a right answer. So it is A is the 6 feet is the right answer. The Pilates mat is 6 feet long, 2 feet wide, and a half to quarter inch of thickness. That's how the Pilates mat. Pilates mat is not compared to the normal yoga mat, because yoga mat is very thin. It is 1/8 of the thickness. So yoga mat is not preferred for the Pilates. So Pilates has a separate mat which has quarter to half inch thickness and 2 feet wide, and it is 6 feet long. Right? So you don't use yoga mat for Pilates. Okay, last question of today's session is which principles of Pilates speak about movement of smooth and fluid? Actually, there are 6 principles of Pilates, and which principle speaks about smooth and liquid movement? Smooth movement.
4 options are here. A, breathing.
Coordination, flow, and concentration. Breathing, coordination, flow, and concentration.
C, B are coming, sir, in YouTube.
Okay. B is not there. So people think that it is coordination, so we put B. B is not the correct answer. The answer is flow. C is the right answer. C is the right answer. So there are 6 principles in the epilators, and all these principles are here: breathing, coordination, concentration, flow of the principles. So that's all for today's session. And the last question for today is, what is the name of the gate? I think I have put the same picture before, but still I just want to show. This is one of the different gate. A gate is the patient walks little different. You can say antalgic gait, but the patient keeps hand on the thigh, so it is also called as quadriceps gait. Hand to knee gait. Although it is not so obvious, you can see the patient have a weak quadriceps muscle. It is antalgic gait also, but it is also called as quadriceps gait and hand to knee gait. So there are so many books, so there are so many questions available in my textbook. I have some blogger also, so so that's it for today's session, and I think we have completed 2 months of the classes, and still one more class on exercise therapy on the next week, and these are the chapters which I would like to inform you. Part 5 in the exercise therapy only. It's massage, so I am going to take half of the questions from massage, and we have balance training, fitness training, exercise prescription, and other missing exercises therapy. Some components I have missed. So everything. So others are 15 questions, and massage is 15 questions, right? Same as like last class. I have given 30 questions to Sir Chandra sir. Probably he will put it in the WhatsApp group. And the same here, massage. We have 15 questions in the PPT and 15 questions for you in the WhatsApp also, as well as the balance and other training sessions will be there.
One of our
So
Zoom
that's it for today's session, and thank you very much, guys.
Yes, sir. One of our Zoom participant raised her hand. Shiny, do you have any questions?
No, sir.
Okay. Yes, sir. Is there any questions from our YouTube participants? Once again, I would like to repeat that we are having one more class of Arun sir, and in future we are going to organize a mock test also. Those who are interested, they can also take that question. 100 questions will be there in our website. You have to attend the questions within 2 hours, and you have to answer all the 100 questions within 2 hours. So be ready for that, prepare, and we are going to organize few more sessions also. Dr. Alagarisen and Maitri from Maharashtra also asking, and we will be organizing their classes, and also 2 or 3 more classes we will arrange. And apart from that, there will be a paid session also. So that will be like 3 hours or 4 hours continuous session. We will be discussing around some 100 questions that will be organized by July, and we hope you will be learning, and also it will be easy for you when you appear for your MPT entrance exams. And no questions in YouTube also, sir. We can wind up now. Thank you, sir. Thank you so much.
Good night, sir.
Good night. Good night, sir. Good night, all.